In downtown Washington, D.C., healthcare groups gathered to urge Congress to stop Medicare cuts scheduled under the 2011 Budget Control Act, also known as sequestration cuts. Representatives from the American Medical Association, the American Hospital Association, and the American Nurses Association spoke out this week about how a 2% scheduled cut to Medicare could result in the loss of more than 760,000 healthcare and related jobs.
Office-based physicians alone supported 4 million jobs in 2009. The Medicare spending sequestration cut would put many of those jobs in jeopardy. As we look to build the healthcare system of the future that focuses more on keeping patients healthy and coordinating their care, physician practices must make investments in technology, in hiring new staff, and in training for their current staff. The impending sequester, paired with more than a decade of essentially flat Medicare payments, denies practices the resources they need to make these investments. We currently have the opportunity to improve and restructure healthcare delivery and payment policy. Congress must take action to remove the threat of an impending cut to physicians who care for Medicare patients. The AMA, along with medical state and specialty societies, sent a letter to Congress today urging the passage of legislation to nullify the sequestration cut. To prevent widespread patient access problems and significant job losses, we must have stability in the Medicare system.
In addition to the impact on patients, how much sense does it really make to cut Medicare funding in a way that will eliminate nearly 500,000 jobs in 2013 alone? The economy is slowly turning around after a devastating financial crisis. Cutting Medicare funding will negate this progress by not only eliminating hundreds of thousands of healthcare jobs, but also by spurring job losses in other industries that also depend on the employment of nurses, doctors, and other healthcare professionals, and the ability of hospitals and other organizations to hire healthcare providers. Job cuts stall the economic recovery and put millions of people at risk for both the financial and health crises that we as a nation cannot afford.
Hospitals' ability to maintain the kind of access to services that their communities need is threatened. Cuts to hospital services could create devastating job losses in communities and the hospitals they rely upon.
Our concern is that by destabilizing the whole payment system right now, either with this 2% sequestration and then for physicians in particular, the 27% cut, it doesn't provide the stability and the amount of time that we need to actually experiment with these new payment models, which I think will get us to a higher performing healthcare system.